Fetal skull, areas of skull, vertex. Quadrangular area bounded anteriorly by the bregma and the coronal structures, behind by the lambda and the lambda sutures, and laterally by lines passing through the parietal eminences. Brow, bounded on the one side by the anterior fontanelle and the coronal sutures, and on the other side by the root of the nose and the supraorbital ridges of the either side. Face, bounded by one side by the root of the nose and the supraorbital ridges, and other by the junction of the forehead mouth with neck. Sincipit lie in front of the anterior fontanelle. Sutures, sagittal or the longitudinal suture between the two parietal bones. Coronal suture between the parietal and the frontal bone on the either side, close 30 to 35 years. Frontal suture between the two frontal bones. Rhamnoid suture separate the occipital bone and the two parietal bone. Metopic suture, calcareous suture on the frontal bone from the nascent to the bregma across the midline, close to 6 years. Significance, permits the gliding movement of the bone over other during the delivery. Digital palpation of the sagittal suture. Manner of engagement of the head is installum or the syncytium, degree of the internal rotation of the head and the degree of molding. Fontanelles. Wide gap in the suture line is called the fontanelle. 2 of the obstetric significance, anterior fontanelle or the bregma, formed by the anteriorly fontanelle, posteriorly sagittal, and on the either side of the coronal. Diameter 3 cm. Ossification 18 months after the birth. Denotes the degree of the ixion of the head. Facilitates the molding of the head. Accommodates the marked brain growth. Reflects the intracranial status. Depressed in the dehydration, elevated in the raised ICT. Collection of the blood and the exchange transfusion. CSF can be drawn. Anterior fontanelle and the supraorbital ridge is felt in the second stage of the labor in the brow presentation. Posterior fontanelle. Junction of the sagittal suture anteriorly and the lambda suture on either side. Measures about 1.2 into 1.2 cm. Its floor is membranous but becomes bony at term. It denotes a portion of the head in relation to the maternal pelvis. Sagittal fontanelle, situated on the sagittal structure at the junction of the anterior 2/3 and the posterior 1/3. Diameters of the skull. The anterior posterior diameter of the head, which may engage or suboccipital obrematic 9.5 cm. Complete flexion vertex. Suboccipital frontal incomplete flexion vertex 10 cm. Occipital frontal 11.5 cm. Marked reflection vertex. Mentovertical 14 cm. Parietal extension pro. Submentovertical 11.5 cm. Incomplete extension phase. Submentogrammatic 9.5 cm. Complete extension phase. The transverse diameter measurement in cm. Biparietal 9.5 cm. Super subparietal 8.5 cm. Bitemporal 8 cm. Bimastoid 7.5 cm. Molding. Alteration of the shape of a forthcoming head while passing through the resistant birth passage during the labor. During the normal delivery, alteration of 4 mm in the skull diameter commonly occurs. Mechanism. Compression of the engaging diameter of the head with the corresponding elongation of the diameter at right angle to eta. Inflexed head of the anterior vertex engaging suboccipital pragmatic diameter is compressed with the elongation of the head in the mentovertical diameter. Parietal bones overlap occipital bone, frontal lobe, and the temporal bone. In the first vertex portion, right parietal bone tends to override the left and the works reverse in the second vertex portion. Folding disappears within a few hours after the birth. Grading 1. Grade 1. Bones touching but not overlapping. Grade 2. Overlapping but easily separated. Grade 3. Fixed overlapping. Slight molding is inevitable and beneficial. Enables the head to pass more easily through the birth canal. Extreme molding as met in the disproportion may reduce the severe intracranial disturbances in form of tearing of the tentorium cerebelli or the subdural hemorrhage. Shape of the molding can be a useful information about the portion of the head also occupied in the pelvis. Caput secundum. Formation of the diffuse Voges swelling due to the stagnation of the serosanguineous fluid in the layers of the scalp beneath the girdle of the contact, crossing the midline suture. Disappears spontaneously within 24 hours after the birth. 8. Descends. Rest over the dilating surface of the vulvar ring. Tissues in contact with the full circumference of the girdle of the contact is compressed. Pain is written and the lymphatic drainage interrupts stagnation of the fluid. Signifies the static portion of the head. Gives an idea about the portion of the head occupied in the pelvis and the degree of flexion achieved. Occipitofrontal is the longest diameter of the fetal skull after the mentovertical. Suboccipitofrontal diameter of the fetal skull is 10 cm. The characteristics of the caput secundum include a process semicircular line and it is a diffuse edematous swelling of the soft tissue of the scalp. Anterior fontanelle and the suborbital ridge is felt in the second stage of the labor in the broad presentation of the vaginal examination. Posterior fontanelle are ossified at that term. 6 number of fontanelle is present in the newborn child. Closure of the coronal suture starts at the age of 30 to 35 years. Anterior fontanelle ossifies by 18 months. Caput secundum in the newborn is due to the collection of the serosaginous fluid in the scalp. The metaphyseal suture closes by the age of 6 years.